my primary thing is I want all the providers, and I don't mean just obstetricians and maternal fetal medicine. I'm talking about, some places family practitioners send aneuploidy testing. Sometimes it's nurse practitioners, sometimes it's midwives, sometimes it's even genetic counselors. So I want all caregivers that provide care for our patients to realize the absolute robustness and of the assay of our Unity aneuploidy assay as first line and front line option, as a first and front line option. Because when they're able to do that at 9 weeks of gestational age, if other circumstances and clinical factors develop, such as an antibody screen that comes back with something that we just went over with respect to the possibility of hemolytic disease of the fetus and newborn. We can then, because we've already done the Unity aneuploidy assay early on, we do not need another maternal blood draw. We just can use the single one tube of blood that was done from the beginning at 9 weeks, no requirement for any paternal blood testing. We can then, from that same blood, add on these additional tests as need be, depending on clinical factors. So I think the primary message is by using the Unity aneuploidy assay and adding on these additional tests as becomes determined, we're extremely streamlining patient care, and really cutting down on the unnecessary workflows in both obstetrical practices and maternal fetal medicine practices. And then while doing all of this, giving the vast majority of patients who do the Unity aneuploidy assay in the first place, even if additional tests are required, that we can reassure them that there's nothing to worry about and that they can have routine obstetrical care. So I think that is one of the primary messages, because these are add-on tests, including the platelet, fetal antigen NIPT test, but they are all run under the premise that the Unity aneuploidy test was completed in the first place.